breastfeeding is instinctive for babies. This is not true for mothers, who learn to breastfeed with practice and by watching others. Many mothers decide to try breastfeeding because they've learned about its importance to lifelong health and wellness. But to make breastfeeding work, it must be comfortable for you and your baby. Your comfort while you are breastfeeding depends primarily on where your nipple lands in your baby's mouth. And where your nipple lands depends primarily on how your baby takes the breast into his mouth. This is called latch-on. To understand how latch-on affects your comfort, let's look inside at the roof of a baby's mouth. Behind the baby's gums are ridges. Behind the ridges is the baby's hard palate. When your baby takes your breast into his mouth, if your nipple lands near the front of his mouth, your nipple will press against his hard palate. This is called a shallow latch, which can cause discomfort for you as he breastfeeds. If your baby breastfeeds with a shallow latch repeatedly, the friction and pressure may eventually cause you pain or even skin damage. Farther back in your baby's mouth, the palate changes from hard to soft. Some call the area near this soft palate the comfort zone. To get a better idea of where this is, use your own tongue to find your soft palate. When your baby takes your breast deeply into his mouth and latches on so that your nipple lands in the comfort zone, there is no undue friction or pressure as your baby breastfeeds. Latching on within the comfort zone is where breastfeeding is most comfortable for you and most effective for your baby. With most young babies, latch-on tends to go more smoothly if the mother starts by first triggering her baby's natural feeding instincts. Just like other mammals, humans are born knowing how to get to the mother's breast and feed. To trigger these inborn feeding instincts, start when your baby is calm, alert, and starting to feel hungry. Open your shirt and hold your baby skin to skin between your breasts. Relax and enjoy this feeling of closeness with your baby. When your baby feels the sensation and warmth of your skin against his, he will soon start to bob his head against your chest. Eventually, he will lunge down toward your breast. As your baby moves toward the breast, talk to him. Look into his eyes, stroke him gently, and encourage him. You can help your baby by simply moving his bottom toward your other breast while supporting his neck and hips. Remember, these are natural human instincts. Your baby knows what to do. When he reaches the breast, help align his body so that his nose is opposite your nipple and his head is free to tilt back. Hold your baby close, with his body pressed against yours and his chin lightly touching your breast. Wait for him to lunge for the breast with his mouth wide open. As he latches on, give him a gentle push from behind his shoulders. That last gentle push will help your nipple reach the comfort zone. When your baby has a good latch, you will feel a gentle tugging at the breast, but you should feel no discomfort. Remember, breastfeeding is supposed to be comfortable for you and for your baby. It should not be painful. If breastfeeding hurts, it's important to ask for help from a board-certified lactation consultant. The sooner you find help, the sooner you and your baby can start to relax and enjoy breastfeeding, which is how it was meant to be for both of you.
we learned how to properly latch, we'll talk about feeding on demand. Breastfeeding is a supply and demand technique. When the baby demands the mother's milk, the mother's body will supply. So that means that in the first couple days especially, you want to feed whenever your baby wants to feed. Don't watch the clock, look for their hunger cues. It'll help develop your supply the more that they nurse. Pumping. If you're away from your baby, it's very important that you pump to remove milk during the times that your baby would normally feed. This will help you to make more milk. It may take a little while for your body to adjust to pumping versus breastfeeding. A few tips for pumping are to relax as much as you can, massage your breast, gently rub your nipples, visualize the milk flowing down, and to think about your baby. You can also bring a picture of your baby or a blanket or an item of the clothing that smells like the baby. That'll sometimes help stimulate the let-down reflex. Breast milk storage guidelines. Here are the breast milk storage guidelines from the Healthy Children Project. On the countertop at room temperature, you can store it up to 3 to 4 hours. You need to throw away any leftover milk within 1 to 2 hours after the baby is finished and feeding from it. In a cooler with an ice pack at approximately 59 degrees, you can keep it for about 24 hours. You need to keep the ice packs in contact with the milk at all times and limit opening the cooler. In the refrigerator, 39 degrees or colder, you can keep it up to 72 hours in the refrigerator. You need to store the milk in the back of the refrigerator so that way it's not exposed to the repeated opening of the refrigerator door. In the freezer, 0 degrees or colder, you can store it up to 6 months. You can store milk in the back of the freezer where the temperature is the most consistent. I recommend that if you're going to store in a freezer a mass quantity, that you label it with the date that you pumped and store the oldest on top and put the newest on the bottom. It tends to work out a little bit better for you. Once you have thawed your breast milk, you need to use it within 24 hours and you do not need to refreeze. Also, never microwave any kind of milk, whether it be formula, breast milk. You can cause the baby to have burns. Commonly asked questions. A lot of people commonly ask about pacifier use with breastfeeding. The American Academy of Pediatrics, they actually do not recommend if you're breastfeeding to use a pacifier for the first 3 months. If you do decide to do so, use it to soothe the baby and then take it away. Don't use it to prolong feedings, to keep them from feeding. Go ahead and feed your baby if it's hungry. Is my baby getting enough food? This is a big concern for mothers, especially in the first few days. A little tool we have here is the shooter marble, this little white marble. The first day, their bellies are about the size of this, so it really doesn't take but 5 to 7 mLs or cc's, whichever unit you're used to fill up their belly. Formula-fed babies are actually overfed from the get-go, and that's why they tend to have more spitting and more acid reflux problems than breastfed babies. The ping pong ball is about day 3, and then the chicken egg is about day 10. So you can see how it'll slowly increase, and your milk supply will be slowly increasing with it as well. When will my milk come in? Your milk is actually in whenever you have the baby. You have colostrum that is being produced until the placenta is separated. Once the placenta is separated from your body, then your body will start to transition its milk, and it usually takes about 3 days for your body to fully transition to where you'll get the whole milk, the fullness sensation in the breast that most people think of when they think of their milk coming in. Your body produces enough colostrum to sustain your baby until that time, and your baby also has mechanisms such as yellow fat to help sustain themselves for the first couple of days as well. Is it supposed to hurt? As we talked about earlier, if the latch at all hurts, it's probably because it's not a very good latch, and you can try to reposition the infant, break the latch, reposition, and relatch to see if that'll help. In summary, Breastfeeding is both beneficial for mother and baby and helps keep both healthy and happy. Breastfeeding on demand, not according to the clock. Watch for the hunger cues and the ideal infant wake state. Latch infant with the asymmetrical latch technique. If the latch hurts, try to reposition infant and relatch. Pump at regular feeding intervals when away from the infant to help maintain supply. Store breast milk according to the guidelines provided. And enjoy this special time and bond with your infant. Any questions? And my references. Thank you.